Hello, my name is Brian Casey. I'm editor-in-chief of AmpMini.com, and we're here at the 2013 edition of the Radiological Society of North America meeting in Chicago. We have with us right now Dr. László Tabár. He is with the University of Uppsala in Sweden. Dr. Tabár, thanks for being with us today.
Thanks very much, Brian.
So the topic of breast imaging has been very prominent lately and is very prominent here at the RSNA. What sort of things are you seeing that you've found interesting here?
I saw one really revolutionary method that is going to help the radiologists to find many more cancers that are called today interval cancers. That is, as you know, breast cancer is a very heterogeneous disease, and there is no one single method that can image them all equally well. So, for example, the biggest problem is the women with dense breast, and what I found really interesting that is going to revolutionize or take the next step of the breast imaging is the ABUS, the automated breast ultrasound, which of course doesn't replace mammography. It's a complement to mammography, and it doesn't examine the whole breast, but the dense portion of the breast where we have a problem. That's one thing. The other thing is a very nice new reporting system, Iconopedia it's called. It's a very user-friendly, very quick and very efficient method that helps the radiologist who reads a lot of mammograms and ultrasound.
Now here in the U.S. you talked about breast density early on. In the U.S. it's been kind of a controversial topic. There have been a lot of laws being passed in different states in the U.S. that require women to be notified if they have dense breast tissue or not. Do you think that's a good idea?
It's a very good idea. First of all, women have the right to know. Secondly, they have to know that the capabilities of mammography is enormous when there is no dense breast, no dense tissue. But there is a limitation. That is, a dense portion of the breast hides breast cancer. And actually, my heart always beats for evidence-based medicine. And fortunately, we are publishing a huge 15,000 women trial that concluded that 30% more invasive breast cancers are going to be found if we combine the automated breast ultrasound to mammography. This is big.
That's an enormous number.
Yes.
Now, what about a technology like breast tomosynthesis? What sort of role do you see that playing in breast imaging?
You see, we are attacking this very complex disease in different fronts. Tomosynthesis is one of the methods, but it's still radiology. It's still the X-ray tube. And what I'd like to send out as a message for the industry, cut back on the dose. So my heart beats for tomography, and tomography really lives its renaissance. But I like to begin with the same dose or no dose at all. That's the ultrasound tomography.
Right, the ultrasound there's no radiation dose involved at all in that.
That's right. So if you are dissatisfied with mammography, as we were, then I'd like to change the tube from X-ray tube to ultrasound or MR.
Exactly. Now, can you talk a little bit more about Iconopedia and what is involved in that?
You know, it's a reporting system with a touch of a button. You can very efficiently make a report and send the report to the referring physicians, patients, and it's you are familiar with the idea of look-alike. That is, the radiologists have a large archive of, let's say, certain type of calcifications, so they can compare their finding with these histologically proven archived material, and it collects also the data. So in the continuation, a breast center, for example, can evaluate its activities and production. So it's a very user-friendly, very easy to make the report.
Is that something that's currently available for breast practices right now?
Yes, it's. I think it's in the beta test level, and it has a nice exhibit here in the RSNA.
All right, very good. Well, Dr. Tabár, thank you for being with us today.
Thanks very much.
All right. Signing off for AmpMini.com, my name is Brian Casey.